I want to tell you about a hallway. 3 o'clock in the morning, a memory care wing in a senior living community. Long fluorescent lights buzzing overhead, 12 doors on the left, 12 doors on the right, and one nurse doing her best, trying to check on 27 human beings before the sun comes up. Behind one of those doors, a woman is awake. Her name doesn't matter right now. Her dementia is in its middle stages. She's not in pain. She's not in crisis. She is just awake and alone and calling softly for her mother, a mother who died 40 years ago. Citizens, this is June. A robot started walking down that hallway. And the question this report is going to answer is not whether the robot belongs there. The question this report is going to answer is what the robot reveals about the system that built that hallway in the first place. Welcome to Wealthy Nation Special Report. I'm Sean Smith. June is Alzheimer's and Brain Awareness Month. Every year, the Alzheimer's Association asks us to wear purple to talk about a disease that affects more than 7 million Americans, to take charge of our brain health before it becomes someone else's problem. So this report is purple, and that's on purpose. But we're not going to do the standard Awareness Month story. No, not today. You can find that anywhere. We're going to do something that's different. We're going to ask the question almost nobody is asking right now. Because 3 weeks ago, at a memory care unit in California, a humanoid robot named Abby started living alongside the residents. Let me say that again. A humanoid robot named Abby started living alongside the residents. Researchers at UC Davis are watching. Families are watching. And every robotics company in America is watching. This story is polarizing. On one side, the people who say this is the answer to a staffing crisis we cannot solve any other way. And on the other side is the people who say we're about to outsource human dignity to a machine. Both sides are wrong about what the real fight is. And that's what this report is about. Let me give you the numbers that nobody wants you to sit with. 16 million Americans over the age of 65 live alone right now. That is the United States Census. This is larger than the population of the state of Pennsylvania. Roughly 1 in 4 older adults. For older women, closer to 1 in 3. And here's what the science says about that. Not what your gut says, not what AARP is saying, not what the latest TikTok says, what the National Academies of Science says. Social isolation is associated with about a 50% higher risk of developing dementia. 50%. That is the same risk level as smoking. If your father smoked, you would worry. You should worry the same way about isolation. The mechanism is different. The math is the same. And then, last October, a meta-analysis of more than 600,000 people made it sharper. Loneliness on its own, separate from being alone, separate from depression, is associated with a 31% higher risk of dementia. You can live in a full house and be lonely. You can live alone and not be lonely. The two things are different. Both are dangerous. Both raise dementia risk. Both, and here's the part that should land, are modifiable. Citizens, let me say this clearly. Loneliness is not a feeling. Loneliness is a brain health issue. If we treated it that way, we'd have started this conversation 30 years ago, but we didn't. And that is how the robot ended up walking down that hallway, because we didn't start this conversation when we should have. And here's what's happening. Not as a rumor, but as a fact. 3 weeks ago, UC Davis Health published an announcement that almost nobody outside the geriatrics community noticed. The Betty Irene Moore School of Nursing at UC Davis has launched the first long-term U.S. study of its kind. It is observational. It is 1 full year. It is led by nurses, not engineers. The location, Catan Village, Carmichael, a memory care community in Northern California. The robot, a 4-foot-tall wheeled humanoid named Abby, built by an Australian company called Andromeda Robotics, founded by a 25-year-old mechatronics engineer named Grace Brown. This is Abby's first deployment in the United States. First one. For 1 full year, Abby's going to live alongside up to 25 residents. She speaks 90 languages. She remembers your name. She remembers your stories. She'll remember your family. She can hold a conversation. She can lead a music game. She can sit beside a resident who's awake at 3 a.m. And here's the part that matters. The lead researcher, Dr. Rochelle Fritz, said the thing that almost nobody in robotics says out loud. She said, short trials tell us whether something works once or twice. What we don't know is what happens after the novelty fades. Most of the robotics in elder care headlines you have ever read are based on pilots that lasted 3 weeks. And 3 weeks is enough time for residents to enjoy something new. 3 weeks is not enough time to find out what happens in month 6 or month 9, or what happens the first time a resident gets frustrated with Abby and shoves her. This study will find out and will tell us the truth, even if the truth is inconvenient. The reason why it can tell us the truth is because it's nurses asking the questions, not engineers, not marketers, and not the company selling the robot, nurses. And we will find out in May of next year what's going on. So back to the robot. This story is polarizing for a reason, and the polarization breaks into 3 voices. And let me give you all 3, and I'm going to give them to you fairly before I tell you what I think. Voice number 1, the philosophers. Now, back in 2002, an Australian philosopher named Robert Sparrow, he wrote a paper called The March of the Robot Dogs. And in it, he argued that any robot companion designed for the elderly is, and I'm using his words, quote, sentimentality of a morally deplorable sort, end quote. Now, his argument boiled down to plain English is this. The robot says it loves you, does not love you. The robot that asks how your day was, doesn't care. And we, as a society, have a duty to tell the truth to the vulnerable people. Letting an elderly person believe a robot is a friend, Sparrow says, is a kind of lie. And he believes we should not be in the business of telling that lie. Now, Sparrow may be right, or Sparrow may be wrong. Sparrow is a philosopher, not a clinician. And he wrote that argument in 2002 before half of the technology in your pocket was invented. But his argument is not crazy. It is one of the strongest critiques in this entire conversation. So we have to take it seriously. Now, voice number 2, the families and future patients. The research on what real people think is mixed. And anyone who tells you it is settled is selling you something that you don't want to buy. In one survey, 67 adults at a public exhibition in the United Kingdom, 6 in 10 said they had no ethical concerns about companion robots for the elderly. Only 6% raised the question of deception. What they actually worried about was the cost. Who can afford one? But in a much larger survey, 825 adults, most of them over the age of 60, nearly 7 in 10 said they would be uncomfortable being allowed to believe a robot was a real person. And nearly 7 in 10 said they did not think a companion robot would actually make them feel less lonely. So which is it? Are people fine with this or are they not? The honest answer is both. And the verdict from real people is it's not unanimous. Voice number 3, the clinical researchers. Now I want you to picture something right now with me. Picture your kitchen. You have a stove, you have a refrigerator, you have a coffee maker. Those appliances do real work. They make life easier. They feed your family. But But here's the thing. None of them is the chef. The chef is you. The appliance helps the chef. The appliance never replaces the chef. I want you to hold that picture because researchers at the University of British Columbia, led by Dr. Lillian Hung, proposed something they call everyday relational ethics. Now, that's a fancy phrase for a simple idea. The robot is the kitchen appliance. It is not the chef. It can hold a hand at 3 a.m. when no human being is in the room. Granted, it can ask about your grandkids when the staff is busy with someone else. True. It can sit beside a resident with dementia and remember her stories week after week. Those are real things. Those help, but it cannot replace your daughter. It cannot replace your nurse. It cannot replace the human being whose name you remember when you have stopped remembering everything else. And the moment anyone tries to use it that way, the moment the appliance gets called the chef, is the day this technology fails. Citizens, let me tell you what I see when the door closes. I've spent decades in healthcare. I'm a certified dementia care trainer. And I want to tell you what really happens, not what the brochures show you. 3 a.m. in a memory care unit is not quiet. It is full of small sounds, a bell, a footstep, a woman calling for her mother. And that's a mother who died 40 years ago. A man asking, "Where's my wife?" when his wife is asleep 3 doors down. That call does not need a robot. It needs a human being who can hold a hand. It needs eye contact. It needs a voice that says, "I see you. You're safe. I'm here." But here's the truth that nobody wants to say. Nobody. There is not always a human being available at 3 a.m. Not because anyone is failing on purpose, because we built a system that treats night staffing like a budget line, not like a human being's last hours. I've stood in those hallways. I've watched residents sit in the dark calling for 45 minutes, waiting for someone to come. That is not the staff's fault. That is the floor plan. That is the ratio. That is the budget. That is the system. So when researchers ask, could a robot help? The clinical answer is maybe. The clinical question that comes before it is, why did we ever build a system where the answer matters? So who's the villain in the story? It's not the robot. It's not the philosopher. It's not the researcher. It's not the nurse working the night shift. It's not the family who placed their mother there. The villain is the system. Specifically, it is a healthcare system that treats loneliness as soft. A system that will measure your blood pressure every visit, but never once ask you who you talked to today. A system with a billing code for every blood test and 0 billing codes for human connection. A system that gives you an 8-minute primary care appointment when the question, who lives with you, would take 30 seconds. A system that reimburses prescription drugs for behavior, but does not reimburse conversation that would prevent the behavior in the first place. In 2023, the U.S. Surgeon General issued a national advisory. Loneliness, that's what he wrote. Loneliness is an epidemic. It is associated with higher rates of heart disease, stroke, dementia, and premature death. He called for action. 3 years later, almost nothing has changed in the way Medicare pays for connection. Almost nothing has changed in the way medical schools teach about loneliness. Almost nothing has changed in the way nursing homes are staffed at 3 a.m. So the robot showed up. Not because the robot was the answer, because the system kept refusing to be the answer. The robot is a workaround for a system that failed to take loneliness seriously. And until we hold the system accountable, more robots will keep showing up. Here's a resolution. You citizens are not waiting on the system. You're not waiting on a robot in California. You're not waiting on a billing code in Washington. You have the answer in your pocket right now. It's called your phone. One of these. It's called your front door. It's called the person you haven't called in 3 weeks. So this week, during Brain Awareness Month, I'm asking you to do 3 things. 3. 1, find someone you know who lives alone. It could be a parent. It could be a neighbor. It could be the cousin you've been meaning to call for 2 months. Call them. Don't text them. Call them. Ask one question. Who did you talk to today? Then listen. 2, if you have a parent or partner in memory care, go visit them this week. Not for an hour, for a meal. Sit through one full meal with them. That meal is the most important medicine you will give them all month. And 3, wear purple this week. Not because the color matters, because someone is going to ask why you're wearing it. And that conversation is what awareness actually is. Awareness is not a hashtag. Awareness is a conversation you have with one human being, one who did not know until you told them. And if you want resources, the Alzheimer's Association runs a free 24-hour helpline at 1-800-272-3900. They have been doing this work since 1980. Now, they're not us, but they are great. Use them. Listen, citizens, the industry never respected us. We were customers to them, numbers on a spreadsheet. But we are building a nation, and in this nation, citizens get the truth. So here's the Wealthy Nation verdict, and we are saying it this June during Alzheimer's and Brain Awareness Month, because there's no better time. The robot in California is not the story. The robot is the symptom. The story is that we built a country where 16 million older Americans live alone, where loneliness is associated with a 50% higher risk of dementia, and where the healthcare system has no billing code for asking who you talk to today. The fight is not robots versus human. The fight is whoever runs the system, choosing between cheap and right. The robot is the kitchen appliance. It's not the chef. And the day anyone tries to call the appliance the chef is the day we, citizens, say no. This nation is older than the technology. This nation is older than the billing codes. This nation knows that connection is the original brain health intervention, and it always will be. Citizens, we don't age quietly. We age wealthily. Take care of your brain.